Hello and welcome to In Our Community. I'm your host, Erin Nelson, and today I have joining with me Dr. Craig Owens, who is a board-certified general surgeon, and today we're going to talk a little bit about varicose veins. Welcome, Doctor.
Thank you, Erin.
Well, let's get our audience members to get to know you a little bit better. Tell us about your medical background and how long you've been practicing.
Well, I'm a general surgeon, board-certified by the American Board of General Surgery. Which means I am a medical doctor and have completed medical school. And after medical school, I completed a general surgery residency at Loma Linda University Medical Center, which took 5 years, and then passed both an oral and a written exam to become board certified. And I've been in practice now for 10 years, and I am practicing with Dr. Michael Chin, who is also a board-certified general surgeon who specializes in vascular surgery. And we have been in the community of Corona now for over 15 years in Mike's case, and I've been here for about a year.
I see. And where were you at before you came here to Corona?
Before Corona, I was practicing in the Palm Springs area, and I also practiced in Richmond, Virginia for a few years before I decided to come home.
And so what was the reason for coming back to Corona?
Well, I'm California born and bred, and Corona is not far from where I was raised. It's close to my family. It's a growing community, becoming a bustling suburb of both Riverside and Orange County, and I like this community very much, and I feel very at home here.
And it seems like a lot of people don't know of all the areas that the Corona Regional Medical Center has to offer. And so with interviewing many doctors, we're finding out that Corona Regional Medical Center has lots of great places to, instead of going outside of the area for a treatment, they can come right here and stay locally. So
That's
it's great
right.
to have you here.
Thank you.
All right. Well, let's ask you a little bit about what causes varicose veins.
Well, I think the first question is, what is varicose veins? And varicose veins are dilated veins. It's an enlarged vein. You can see them from afar in a lot of cases, and it's a vein that has become dilated. And the reason a vein becomes dilated is that the pressure inside the vein is causing the vein wall to expand. And the main cause of varicose veins is a faulty valve up in the groin that is in the greater saphenous vein, that vein that runs along the inside of the thigh, that the cardiac surgeons use to do a bypass in the heart.
Right.
It has a valve up in the groin that keeps blood flowing from the leg to the heart. And what happens in some people is that valve will become faulty. And when that valve becomes faulty, it allows blood to flow the other way, and the pressure from all of the blood sitting above the leg is now transmitted down through this faulty vein, increasing the pressure in the veins down in the leg. And those veins aren't designed for that pressure, and that valve is supposed to keep that from happening, and those veins will become dilated and become disfiguring and cause significant pain.
Right. Tell us what the difference is between a spider vein and a varicose vein. I know many people are kind of confused about the difference between the two. Can you tell us about that?
Well, the varicose veins are the large veins that I just described. A spider vein are tiny, tiny little veins that are actually inside of the skin itself. Now, those veins are, spider veins are caused by a different set of problems, although they can have tiny little feeder veins attached to varicose veins, and we deal with them in a little bit a different way. The varicose veins, we have to determine if the valve is faulty, and then you have to address that faulty valve. The spider veins can be dealt with either by injection of material to cause them to clot off and disappear, or lasers can take care of spider veins quite nicely as well.
Right, that's good. What are varicose veins? What are their primary condition? Does it affect women or men, or who is able to get or to develop varicose veins?
Well, it affects both, actually, and it affects people to a much greater degree than I think anybody previously appreciated. As a matter of fact, by the time people reach their retirement years in the 60s and 70s, more than half of all women will have painful varicose veins,
Really?
and slightly less than half of all men will have painful varicose veins. So it's a problem that affects about
Can affect
25 million people in this country.
Wow.
That's about 1 in 11 or 12 people, and it's probably going to become more common.
Really? All right, well, I have to take a commercial break, and when we come back, we'll pick up right where we left off.
Okay, Erin.
All right, we'll be right back.
Your kids won't tell you what you want to know about ecstasy, but we will. Go to drugfreeamerica.org. Your kids might think they know everything about crystal meth. You really can. Go to drugfreeamerica.org.
Welcome back to In Our Community. Today I have with me Dr. Craig Owens, who is a board-certified general surgeon. Welcome back, doctor.
Thank you.
And let's go in talking about varicose veins and who is at risk for receiving varicose veins.
Everybody's at risk for developing varicose veins, and the risk of developing varicose veins increases as one gets older. There are certain conditions that predispose one to developing varicose veins, and having had children is one of those risks. Anybody who's had developed blood clots in their legs or thrombophlebitis or deep venous thrombosis is also at increased risk. But the fact of the matter is varicose veins can occur in anyone.
And what are some of the signs and symptoms of varicose veins?
The most common sign is a visible dilated vein that one can see, and it will actually cause pain at some point during the course of its evolution, and the more extensive they get, the more uncomfortable they can be.
Now, determining between spider veins and varicose veins, do spider veins cause any pain, or is it just the varicose veins that present pain?
Spider veins probably don't cause pain. Spider veins are those tiny little veins you'll see right under the skin layer, and they're probably more of a cosmetic issue than a pain issue. The varicose veins are the dilated, much larger veins that are actually underneath the skin, and those can be quite problematic.
Right. And I know technology has showed that removal of veins have come a long way than several years ago. Can you tell us a little bit about how people seek treatment for removal of varicose veins?
Well, there are several ways to deal with varicose veins, and in the old days we used to do what we called vein stripping, where we would put a device starting down in the leg and run it all the way up into the thigh and tie it off there, and actually just rip it right out of the patient's leg. As one might imagine, that caused a fair amount of discomfort.
It's a good thing they're not doing that anymore.
That's right. Times have evolved, and we have much better ways to deal with varicose veins now.
That's great. So what can you do now?
Well, now we have a catheter-based system, and if one has varicose veins due to increased pressure in the vein and reflux, we have a small catheter called the venous closure system that we insert through the vein down in the leg, advance it up into the groin area under ultrasound guidance, and then we pull that catheter out very slowly and activate a probe on it that causes that vein to collapse and basically go away.
Right. Now, do some patients tend to have more varicose veins than others? Or are there just some people more predominant to receiving them?
Well, it comes in all shapes and sizes, and one could have varicose veins that are limited to a very small segment of their leg, and other people will have varicose veins from their ankle to their groin on both sides and completely around the whole extremity, and they can be quite disabling.
Talking a little bit more about treatment, how do physician and patients determine the appropriate treatment that they receive for the varicose veins?
Well, you have to determine what's causing the varicose veins to determine how to treat them. And for the painful varicose veins in the leg, one has to decide are those varicose veins due to the fact that the greater saphenous vein, which is a large vein that runs on the inside of the thigh, which is the vein that the heart surgeons take out to do bypass surgery in the heart. There's a valve up in the groin area that keeps blood moving from the leg up into the heart.
Right.
And that valve is designed so it doesn't allow blood to rush the other way. And what happens is sometimes in some individuals that valve will become defective, and that allows all of the blood in the upper part of the abdomen to transmit its pressure down into the leg.
Right.
And the problem with that is that vein, that greater saphenous vein, and all of its little tributaries or branches that come off of it are not designed to hold that kind of a pressure.
Right.
And when they see that pressure for extended period of time, they have very weak walls and they will just dilate up.
Right.
And when that happens, that can cause a great amount of discomfort. So the question is that valve good or is that valve bad? And there's a very easy way to distinguish that. One can do an ultrasound of the groin area in a few minutes, a very simple, painless test, and we can determine whether or not that valve is competent or not.
Right. Okay. Well, and I have a personal question about, when you close off the veins, does it, I know it's a main, maybe not necessarily a main artery or vein or anything, but does it affect any other part of your body once you would remove that vein or close it off?
Well, there are other veins in the leg. There are the deep veins that are inside the muscle compartment itself, and those veins also bring back blood to the heart. So taking out that one vein and dealing with the varicose veins does not affect the return of blood to the heart.
The closure catheter is introduced into the refluxing vein and is navigated and positioned at the saphenofemoral junction under ultrasound guidance. Catheter electrodes are deployed, contacting the vein wall. Tumescent anesthesia is injected up the vein into the saphenous compartment to provide skin protection, exsanguination, and compression of the vein onto the electrodes. RF energy is turned on and pullback begins. This controlled heating of the vein wall causes shortening and thickening of collagen fibrils to help shrink the vein. Endothelium is denuded and the vein lumen is acutely narrowed. This stimulates fibrotic sealing and occlusion of the vein. When the electrodes reach the introducer sheath, RF energy is turned off and the catheter removed. The fibrotically occluded vein is resorbed by the surrounding tissue.
Welcome back, and we're talking with Dr. Owens about varicose veins. And doctor, let's talk a little bit about how successful are conservative treatments for varicose veins.
It depends on how bad the problem is, and we do have non-invasive treatment for varicose veins, and the most popular one is anything that will support the veins in the leg will probably help the symptoms to some degree. The most common is support hose. And I don't mean the support hose that you buy in your local grocery store, but rather support hose that's obtained by a special prescription from a physician.
Right.
And those, for people who have rather minor symptoms and aren't bothered too much, can use the support hose, and some people will find some relief from those.
Right. And what other treatments can people receive?
Aside from the vein closure treatment that we do, there are other treatments for different types of varicose veins. If you have the small spider veins, which are really not varicose veins, those can be treated by laser or they can be treated by injection. Very small varicose veins can also be treated by injection. But if the problem is that there's too much pressure because of a bad valve up in the groin, that can only be treated appropriately by eliminating that vein.
And then what conditions do these treat?
They treat mostly the pain and discomfort associated with varicose veins, and that can be severe pain when standing to people who develop severe achiness at the end of a day, and some people can be disabled to the point where they just can't spend much time on their feet anymore.
Right. Well, let's talk about what you have here, which I understand to be called the venous closure, which sounds like a really wonderful new technique that you're able to offer. Tell us a little bit about that procedure.
The venous closure technique has been available now for about 5 years. It's brand new to the Corona area. And it involves a very long catheter that we insert down below the knee. We find the vein using ultrasound, and we guide that catheter using ultrasound all the way up into the groin to where it's very close to that valve, a couple of centimeters below that valve. And then we can open that catheter, and when we open it, it touches the walls of the vein, and when we activate the catheter and pull it back, it causes that vein to shrink down and clot off.
Wow, sounds like a pretty neat.
Pretty high tech.
Yeah, sounds like a lot better than past procedures.
It's certainly better than the vein stripping that we talked about earlier. It causes much less discomfort.
Yeah.
We do it as an outpatient now. Most people go home the same day, take very little pain medication, and most people are up on their feet and going about their activities of daily living within a day or two.
Right, well that's definitely good news.
Yes.
For patients who are concerned about that.
It's definitely a world away from vein stripping.
Right. And how long does that procedure happen to take?
It takes about an hour to an hour and a half from the time we start to the time we're
And then
done.
they're able to go home
An hour
soon,
later, they're out of the
shortly after.
recovery room and they're on their way home.
Yeah, that's great. And what does a patient have to do to prepare for this type of procedure?
The main thing is we have to determine that the valve is the problem, and we will get an ultrasound on every patient prior to the surgery. Other than that, it's just a routine preoperative test that we get for anybody undergoing surgery.
Right. Okay. Well, now I'm going to ask you a few questions. We have some questions from our viewers about varicose veins, and this one comes from Andrea in Riverside. She asks, do you know if most insurances cover varicose vein removal?
Most insurances, including Medicare, cover the venous vein closure system, and we participate in virtually every insurance that's available in this community.
Oh, all right. And this next question here, it looks like it's from Austin in Miraloma, and he asks, it has been suggested that lack of fiber in the diet and sitting and straining on the lavatory causes varicose veins. Is that true?
Well, people who have problems in the lavatory do increase their abdominal wall pressures when they're having a bowel movement, but it's probably a temporary problem. If one has already incompetence of that valve, then I think it can make the problem worse. But in and of itself, I don't think it causes varicose veins.
Right, okay. Let's see, we have Renee from Corona, and she asks, can tight clothes cause varicose veins?
Probably not. I think it can make varicose veins worse. Particularly if the valve is incompetent. Anything that will increase the pressure around the legs or the midsection or increase abdominal pressure, as we talked about before, can make varicose veins worse, but they're not causing the varicose veins.
Right. Okay. And let's take another one here. I think we might have touched on this a little bit, but I'll ask it again. What are some of the symptoms of varicose veins? And that's from Kathy and Corona.
Most common symptom is pain. People that have painful varicose veins will generally do okay in the morning because they've been lying down all day and there's not been a whole lot of pressure on their varicose veins. But they'll find that as the day progresses, they get more and more discomfort in their legs. It's heavy, it aches, it causes pain in walking. It actually can cause pain in the skin as well. Usually as the day goes on, they get worse.
Right. And this one here is from Amber in Corona, and she asks about what the percentage of women in the United States have vein problems. Now, I'm assuming that it is more predominant in women, but do most women receive some type or some kind of varicose veins?
Most women live with the problem. We have, as a society, become more aware of the problem, and it's a much bigger problem than most people think. As a matter of fact, most women, by the time they reach their retirement years, will have problems with varicose veins.
Really?
I think the percentage is about 60 to 65% by the time a woman is in her 60s.
And is there some kind of prevention that women can do to prevent that from later on in their life?
Again, it depends on what's causing the varicose veins, and if the problem is with an incompetent valve, we haven't figured out how to prevent that from happening yet.
Right. And I personally have heard that one strategy of eliminating it is when you come home from work is to lay down on the couch and elevate your feet. Is that something that women should do if they're concerned about having varicose veins down the road?
I think that that will help you if you have symptoms from varicose veins, and we generally recommend for people who have very mild symptoms to wear support hose, keep their feet up when they're sitting around watching TV, and I think that will help with the symptoms, particularly if the symptoms are mild, but it doesn't address the problem.
Right. Okay, thanks, Dr. Owens. Well, we're going to take a commercial break, and we'll pick up where we left off. We'll be right back.
Thank you.
I will never see her walk down the aisle in her graduation gown. I will never watch her fidget as her father grills her homecoming date. Because after she had a few wine coolers and a short drive, our family will never be the same. Her conviction means I won't have to warn her about drinking and driving for the rest of this decade. Set boundaries and consequences. Tell your teen, never drink and drive. Check yourself.
Welcome back. And Dr. Owens, we're going to take a few more questions here. And this one comes from Edward in Corona, and he asks, is being overweight a contributing factor in varicose veins?
Being overweight is definitely a contributing factor in making varicose veins worse. Anybody that has increased pressures on their legs, such as being overweight, will definitely suffer earlier onset of varicose veins, and they'll become more painful and probably larger and need to be dealt with sooner.
Right. And that actually can lead into this next question here. And this one comes from, I think, John in Norco. And he asks, is it true that varicose veins are more common in people who stand up at work, particularly those who stand still for long periods of time?
I think it is more common because of what we talked about with the faulty valve in the groin area. Anybody who's standing for long periods of time sees that pressure higher in their legs for a longer period of time. That will accelerate the dilation of the veins in the legs and cause an earlier onset of varicose veins.
Right. And this one comes from Charlie in Corona, and he asks, why do veins become varicose?
They become varicose because they're not designed for high pressures. The veins that become varicose are very superficial. They're lying right underneath the skin, and they're very thin-walled veins. And their job is to send blood back to the heart, and they do that very well. But what they're not used to is a very high pressure. So if that valve in the groin isn't functioning well, that means all the blood that's sitting above that valve is transmitting its pressure to those veins, and those very thin-walled veins are not designed for that pressure, and what they do, like a tire that's becoming thin, is it'll balloon out. And then when it balloons out, it causes a disfiguring vein as well as a painful vein.
Right. Well, let's take one more question here. And let's see, we talked about some of the symptoms, and Lindsay in Riverside asks, what is the difference between arteries and veins? And we kind of touched on that a little bit. Can you give us another description?
Sure. Arteries take blood away from the heart and distributes oxygenated blood to all of the tissues in the body. That's what the heart does, and then that blood has to get back to the heart so that it's recirculated because it's a continuous process. So the arteries are connected to veins by little capillaries in all of the tissues. The capillaries coalesce and merge into venules, which are small veins, and small venules coalesce into larger veins, and then the veins transmit the blood back to the heart, and the whole process can start over.
All right. Well, what would you like to tell our viewers in our last couple minutes that we have here about varicose veins and maybe how they can reach you for more information?
Sure. I think if you're a person out there and you're suffering from varicose veins, in the year 2005, you don't have to suffer anymore. We have state-of-the-art technology that can eliminate painful varicose veins with a very short hospital procedure. It'll have you back up on your feet in a day or two, and it's covered by most insurance and Medicare if you have the faulty valve, and there's no point in suffering anymore. We can take care of your problem now. And if you would like to get in contact with us, we can be reached at Corona Regional Medical Center at 737-4343, or you can contact the Mission Surgical Clinic at area code 951-278-8870. We'd be glad to evaluate you and see if we could get you back on your feet again.
All right, sounds great. Thank you so much, Dr. Owens.
Thank you for having me.
Letting us know a little bit more information about varicose veins, and people just don't have to suffer from pain anymore.
People don't have to suffer anymore.
That's right. Well, thank you very much. And we'll see you next time. Thanks for watching.